Good evening, and thank you everyone for joining the Health Equity Council this evening. We have some very special guests joining us. We have a team of community health workers here from the city of Albuquerque, supporting communities in Bernal County. So we're very excited to have everyone here. We would also like to announce at the Health Equity Council, prior to getting into our community dialogue, is that we are still providing COVID tests for communities. So if your place of business, your children's school, your family, you would like to have COVID tests, you are welcome to reach out. I'll put my email in the chat, and you can make arrangements to pick up COVID tests anytime during the week. So we just want the community to know that we are still providing PPE and COVID tests support for, and a lot of the tests that we're providing are for teachers, community health workers, Head Start. So we know that there's still a large gap in access to testing. And so we want to provide that. And so we want to let everyone know you're welcome to also stop by our office at 220 Suite A, 220 Adams Street, Suite A, and we'll put that information and keep it in the chat. So thank you so much, everyone, for joining us this evening. My name is Carmela Roybal. I'm actually originally from northern New Mexico, Oklahoma and Budo. So I'm really pleased to be able to support all of our community in Albuquerque. I'm going to pass it to our show's partners here. Anna, if you'd like to introduce yourself and a little bit about the Rebuild Grant and kind of what we are working on.
Absolutely. Good evening, everybody. Anna Horner, I'm with the Health Council supporting Dr. Roybal in these conversations. These conversations have come out of a health equity and community rebuilding program. This program is supported by the CDC and Kellogg Foundation. This program includes county and tribal health councils across the state, and it's really focused on community collaboration and engagement to address community rebuilding during this COVID time and health equity. Some of the key partners of this project include the New Mexico Alliance of Health Councils, the New Mexico Department of Health, the Center for Health Innovation, and Community Health Worker Initiative. And thank you all for joining us today, and we look forward to continuing to host these conversations and hope you come back to join us in the future.
Thank you, Anna. Diana?
Hi, everyone. Good evening. My name is Diana Lopez, and I am a health promotion specialist with the New Mexico Department of Health. I serve on the Northwest region team, primarily serving Bernalillo County, and I have the great pleasure of working with the Health Equity Council for about 4 years now, but working with them on a daily basis. And I'm happy to be here today. I'm happy to answer any questions if they come up, particularly around COVID or around community initiatives. And thank you, Carmela. I'll pass it back to you.
Thank you, Diana. And I want to let the audience know also that you're welcome to send questions. You are able on Facebook. You can go ahead and send if you have a question for any of our guests. Diana here, who's the health promotion specialist. And we also have Enrique Cardial, who is our executive director. But if you have any questions of our team or any of our guests, you're welcome to type those in. So we're excited to have and be able to just connect with you all this way. Enrique, would you like to say a few words before we get started with our guests?
Hello, everybody. My name is Enrique Cardial. I'm the director of the Health Equity Council, and I'm about to get in the car and be driving. But this process has been a great learning for us to begin to get better at reaching out to folks virtually, even though we're expected to be in person eventually soon. We know that this is important for people who can't travel maybe out of county or have some physical mobility issues, and for folks who are still not comfortable meeting in person. So this is a great growing experience for us, and this is a great team. Dr. Roybal, Anna, Diana, Matt, and all the folks from DOH and all our other partners. This is, and the community health workers, this is just a really great experience. And I thank you all for being here. And I will drop off some point soon because I can only drive and pay attention so much.
Thank you, Enrique. And so now let's go ahead with our guests. I'm going to invite you, each of you, to introduce yourselves, the agency that you're working with. I'd like to know a little bit about your background, where you're from, and then a really important question around what's the driver behind the work that you're doing? How did you come to this field? And because we really want to talk about and open this up around like the importance and the role that community health workers play and how important that is to our New Mexico community. And so even though this is set up through Bernalillo County, our audience is across the state of New Mexico and even outside. So I just, if you want to share anything along those lines, that would be great. And we can start with Fred.
Hello, everyone. Thank you so much for having me. My name is Fred Hernandez. I am with Casa de Salud. We are a primary healthcare clinic located in the South Valley of Albuquerque. We offer so many amazing things, from opioid addiction treatment to queer, transgender, LGBTQ care, women's health, syringe exchange, medical debt navigation for uninsured patients. It's an amazing program that really just illustrates how connected we are to our communities and to one another. I'm from Albuquerque, born in this area as well. How I came here, it was an interesting situation. Mid-20s, I got burnt out working corporate work, and I decided to kind of do a complete 180 in my life. And I realized that where I wanted to spend my time was what was important to me. And what is fundamentally important to me was my family, my community. And there was always just a complete draw for a sense of empowerment, watching justice within my community and the people that, I was around. And so I started working through nonprofits, including like the Coalition in Homelessness and stuff like that. It was an amazing opportunity to get my foot in the door through my services in the AmeriCorps. Recently I started working with Casa de Salud. The director, Angeli, which is an amazing leader, reached out to me and said, hey, your background, we would love to meet with you. And it was just perfect timing of how, my core values aligned with what a lot of these agencies are trying to do. And so one thing that I'll always remember, and what was taught to me growing up, is being a monolingual family and household. I've always taken the mantle of representing my family, translating documents and explaining things at a very early age, and it all revolved around empowerment. And I will never forget what was told to me: empower yourself so you can empower others. And that's always stuck with me. And so this is how I feel like I can translate that. I want to empower my community. I want to empower my people. And this is the best way I can do it. So yeah, that's why I'm here.
Thank you. Thank you so much for that introduction and background. And we're going to have a lot of questions for you. But this is great. This is a great resource for the community. So originally these talks, and I hope they continue, we call it Salud y Querencia. So really that place that we love, that land that we hold to, and that family, so that strength. Salud is health, and Querencia is really, the land, but it's really the people that we love and that we hold and gain strength from. So these talks really centered around that value that you just spoke about. So what a great introduction to really the values that we have here at the Health Equity Council as well. I will turn to you, Crystal, if you want to go ahead. Thank you.
Hello, everyone. I'm Crystal. I work with First Choice Community Health. I'm part of the COVID equity team there. I was born and raised in Albuquerque. Let's see, I got into this line of work because I like helping people. I was in education before this, and we did similar things to help the community there. It was just with kids instead of adults. but this has been a very good and different experience for me, just because helping the community is way bigger than just the education part, because it's not only helping the kids, it's helping families in a whole instead of just, individual children. And I actually really enjoy it. I don't have much else to say, like Fred. After going after him is not the best, but yeah, I don't really have much else to say, just besides that I like to help my community, and that's why I got into this line of work.
Thank you so much, Crystal. But your values are so in line with all of our values. Community first. These are really around our, core values and kind of what the driver of us really wanting to do that. So thank you for illustrating that. Also illustrating the fact that, you're helping families, you have this different reach. And that's really important as far as making impact, helping children, you help the family, you help the children. And so I think that's really special what you're doing. So thank you. I'm going to go to Karina. Thank you.
Hello, everybody. Good afternoon. Buenas tardes. My name is Karina Veleta. I'm a community healthcare worker for the COVID equity team at First Choice Community Healthcare. I've been a community healthcare worker for, I think, about 6 months already. I started with First Choice in December, and I think it's been one of the best decisions that I've ever done. I've always worked in healthcare. I volunteered at small clinics here in our communities and even larger hospitals. And I just recently graduated from the University of New Mexico last year with population health and Spanish. And I think throughout my school years, I noticed that there was a lot of barriers in the communities, and I knew that I wanted to be a person that was going to make a positive impact for communities and families. I was born and raised here in Albuquerque, and I grew up in the South Valley. And just realizing all the barriers that our communities go through at such a young age, I just realized, there's something that we need to do for our communities. Like, why are these people not getting healthcare? What is it that they need? And ever since then, I knew I needed to be someone, that impact this community. And I love helping everybody in general. And, when I talk to patients and they tell me, thank you so much, for giving me access to transportation or giving me access to COVID home testing kits, like, it's such a rewarding feeling because I know that I'm already, making a positive impact. So it's a great position to be in, and I'm very glad to be here. Thank you.
Thank you, Karina. That's wonderful. And congratulations on finishing your degree in population health. Especially, it's so needed, so needed, especially here in New Mexico, where we have so many disparities in all of these different areas, which we'll talk about. So thank you. And I want to turn to John.
Hi, everybody. Excuse me. Hi, thank you for having us. My name is John Schmidt, and I am the COVID equity team supervisor and community health worker supervisor with First Choice Community Healthcare. So I work with Crystal and Karina out of the South Valley. They're in Albuquerque, but we also have clinics in Edgewood, Los Lunas, and Berlin. And I've been with First Choice for 6 years now. I've worked with the state of New Mexico Human Services Department for close to 8 years before then, doing SNAP, TANF, Medicaid eligibility work. I've also worked as a case manager in Tucson, and I worked at a transitional living center for homeless families in Ventura County, California. So I'm originally from San Diego. I'm not from Albuquerque, but I've been here about 16 years, and my son was born here, and we have a home, and so it's kind of our adopted home. I think what really led me down this path was, like Fred, I was a AmeriCorps volunteer. That was my position there in California. And I got to work with some amazing mentors who were kind of products from the 60s, right? They're old kind of hippies. And I realized early age I wanted to emulate them. Like, they were people I really looked up to. And so That's just kind of you get choked up thinking about it, to be honest. I don't really talk about it too much, but just really, really neat people. Yeah. And so that's kind of pushed me in this direction, and I think about them a lot. So thank you.
Thank you, John. And it is really emotional. So New Mexico has had a long history of having, barriers, lack of resources, lack of healthcare across the state. And there were many families that got together even during like the 50s, 60s, 70s to build community health centers across northern New Mexico. So those are some of the first, and really struggling to provide services. So I feel like all of this work that's being done is really an extension of a lot of the groundwork to just be able to provide healthcare. We have a long way to go, and you're right, like we need all hands on deck. And this is also to really encourage those that are watching us. If you're in school or you're thinking about going back, this is a great field and there's so many components to it, but it's a great field to get into. And we'll talk a little bit more about that. So I'm going to pass it to Teresa Williams. Thank you.
Hi, everyone. My name is Teresa Williams, and I am the training specialist with the University of New Mexico. And I work with the Community Health Workers Initiative grant, and our focus is health literacy. So we are trying to empower the community to give them information about their health in ways that they can understand it so that they can make good decisions about their health. So we focus on COVID-19 for right now, but in the second part of our grant, we'll also focus on other health issues that people may be dealing with in the community. So I'm originally from La Puente, California, but I've lived in Texas about half of my life, and I just moved here from Texas about 2 months ago. And so I'm excited to be here. What has driven me to this particular opportunity is like everyone else, I love to give back. And my background is mostly in adult learning and IT or technology. So I love to be able to combine those two things with my passion of helping others. So I'm glad to be here. Thank you.
Thank you so much for sharing. So I'm going to turn to actually John, and could you give us a kind of definition, basic, really, what is a community health worker? What does that entail? And then I'll pass it to Teresa after, if you could talk a little bit about what goes into that and what's the training, what do we need to do, and then we'll talk with our health workers after.
Thank you, Dr. Roybal. Yeah, so a community health worker can look differently, right? It's a really broad job title for a position that can look differently depending on the agency, the location. Like in developing countries, right, a community health worker can be like a surrogate provider, medical provider almost, right? Where distances are great and providers are few. You see community health workers taking on that role. At First Choice, we use community health workers to address social determinants of health, right? So barriers that are preventing patients from adhering to their medication regimen or making their appointments. So things around transportation, housing, medical insurance, the list goes on and on. But we work in tandem with the providers and the patients to help address those social determinants of health so that the patient can get to their medical appointment, can get their medication, and take it appropriately. We don't use community health workers as much for health education, right? We have separate team members that deal more specifically with like diabetes education or nutrition or diet, hypertension. But that being said, community health workers at other agencies, even in Albuquerque, might be utilized in that manner. So it really depends, I think, on the agency and the location.
Thank you. And Teresa, what is the training? What does this look like, and how do you provide support from there?
Absolutely. So with the health literacy grant, we want to empower the CHWs so that they can empower their community and the people who need their services. So we provide training in the form of Teach Back, which is the conversation that the CHW has with a patient or a client, and listening to that client, give them information, but also allowing the client to teach back to the CHW what they heard in the conversation. So that's Teach Back. We also do plain language. So we have a health literacy office within the HSC hospital that helps with converting documents into plain language. So we're just making sure that what the publications that we give are easily understandable, and just making sure that that particular component is covered. So plain language. We also have health coaching. So again, empowering the CHWs on how to coach the client or the patient on making decisions that they want to improve on with their health. So just different tools that we provide the CHW so that they can help the community. Related to COVID-19, we have what we call a flip chart. And so on one side of the flip chart, it has the information the CHW will see. And then on the other side of the flip chart is what the client will see. So related to the vaccine and booster information, trying to dispel any myths related to the vaccine. So those type of tools are what we use to empower the CHWs. So that's what we do within the Community Health Worker Initiative Health Literacy Grant.
Thank you for that. Thank you. So there's a spectrum, so you can work in these different areas. Literacy, teaching about access. I have a question for you, Fred. So anyone can kind of answer this, but Fred, can you talk to me about kind of like the demographic breakdown, the disparities within that, and maybe some of the barriers that you're seeing? And then after that, we'll move to our health workers to really talk about your lived experience within that context. So thank
Absolutely.
you.
So here at Casa de Salud, we definitely focus on the South Valley, so predominantly Latinos. A lot of these are big families. We serve the undocumented community. We obviously monolinguistic individuals. So the barriers and what we've been trying to focus on as CHWs are the roles of liaisons, being the connector, the bridge to provide access to the education. We noticed that language is obviously a barrier. So we ensure that our CHWs are bilingual, are able to communicate and interpret, but also speak the same language. We want to meet our community and anybody that we serve at wherever they are at. Digital seems to be a barrier for us as well. So we have to be able to navigate, the digital barrier. The individuals that we work with may not have access to a cell phone or a smartphone, may not even know how to navigate through that technology. So we want to basically hold and create and expand a space by building trust within our communities. So word of mouth definitely travels. And now we're getting individuals that come in saying, hey, my neighbor sent me over here. Can you help me how you helped her? Can you explain this to us? Can you explain this letter? Can you explain this process? A lot of the services that are being currently provided for COVID, such as setting up an appointment to get your PCR test, getting your appointment for your vaccine, a lot of it is online, and we kind of take for granted of how easy it is for us to be able to navigate those systems. But we have people that haven't gotten tested for fear of not even knowing how to go in to that. So spreading the word, and I mean, that's how we feel like we've been empowering our community through those modes as access, providing the information, meeting them where they're at, and acknowledging that these are actual barriers that need to be addressed and not taken for likely.
Thank you, Fred. I think you've all mentioned something really important, like around access and, filling out, registering for Medicaid or being able to provide. So a lot of what I hear in the community is fear of not being able to pay for services. And that could be anything from a mammogram to dental care. So how, as CHWs, what kind of guidance can you provide for the community, around that? Is there support for that? How would a CHW, how would your agencies handle that? How do they handle that? And this is, it's around COVID. We heard a lot from our community earlier talking about not going to get services when they did have COVID and were in fact very ill. So they had that fear of, one, the language, also deportation, and not knowing how to pay or how to navigate. And so if there's anything, those that are watching that can take from this, that information would be really pertinent.
Yeah, well, I know Casa de Salud, I believe you guys, well, I'll let Fred speak to Casa de Salud, but at least at First Choice, we do have a sliding fee scale, right, for folks who aren't insured. So that includes undocumented folks. We can go as low as $30 for a medical visit, and we can go as low as $5 for a behavioral health visit. We also have a dental clinic, and so, but I don't know what the sliding fee scale that goes down to for the dental services. But those are all options for undocumented folks. We also, if people are needing to see specialists, we'll refer them to UNMH. Their UNM Cares plan and their financial aid program can work with undocumented folks as well. So Casa de Salud, again, I'll let Fred speak to them, but we also share, our South Valley side actually shares a campus with public health. So that's also a resource that we could route people to. So thank you.
Yeah, thank you. Yeah, absolutely. We definitely do something similar here. Like, we are so proactive and adamant about serving those underserved parts of our communities, our community members. We made it a mission of ours to have quality primary and acute healthcare for everyone, despite having insurance. I mean, one of the main things that we constantly ruminate about here at Casa de Salud is healthcare in general is political, and whether we try to lobby to become more transparent or becoming more accessible, it trickles down. And so as CHWs, we kind of want to fit those gaps, demystifying a lot of these misunderstood notions and these fears that people genuinely have. We want to create that Casa safe place for these individuals. So we have a flat fee of $40, regardless if you have insurance or not. And we've worked with a lot of providers here to be able to allow those things to happen. Women's health, there's a lot to say that, we have a mother, who works and takes care of her family, who hasn't gone to the hospital to get necessary diagnostics that had been pushed out for years and years and years. And then when something huge happens, it's caught her by surprise. There's a huge financial issue that comes with that, and it's scary. And so we work with women's hospitals to be able to find, either free services, do the mammograms for free, all that sort of stuff. Because again, we feel like everybody should be able to have access to this thing. But the main thing is educating people. They don't really know that these services are available to them. And that's kind of where CHWs fit in the clinic, is say, hey, by the way, we can set you up with all of this COVID stuff, but did you know, this is the other services. Do you have any other questions? I'm here to help you. Like, I'm not trying to push this on you, but just so you know, we're here to help. Do you need help with your rent? Do you need help with your utilities? We have services that we can help you and walk you through, and gain confidence from the community in that manner as well.
Thank you. And I love being able to broadcast this and just get this information so that when we do have guests or we do have people that come to the community, we can direct them, to your respective agencies for help. So this is like one of those links and those pieces that we've really needed to make for a long time with the HEC so that we can, you know, have a good idea about what you provide. So, you know, following this dialogue, it would be great, you know, just for us, you know, at the HEC, just to really look at the different things that you provide so that can be part of our referral system as well. A lot of people know that we work in the community, so we get messages constantly about, you know, do you know where to get this, or can we help with this? And, you know, we really, so this is that part that I'm really excited to be able to offer and to share. So I'm really excited to talk to you, Karina and Crystal, about your experience as a CHW. And so I really want to open the floor to you two to tell us about your work, your experience, maybe barriers. I'll ask more questions, but I'd like to just open the floor to you to just talk about what you do and what you've been seeing and maybe how things have changed through COVID.
Yeah, definitely. Thank you. So as part of the COVID equity team, we are focusing right now in getting our community connected with, you know, resources as far as getting tested, getting at-home testing kits, getting the vaccine, getting boosters, and just simply giving education on what COVID is. A lot of people still to these days, when we call, they say, no, like COVID doesn't exist. And sometimes I feel that that's like such a hard situation to address, because of course you don't want to, you know, disagree with the patient that you're talking to, but you also want to make sure that they have, you know, the right information. We want them to be safe and stay healthy, most importantly. And I think that's one of the toughest situations sometimes when we call patients and we let them know, like, hey, we're offering COVID kits, and they automatically say, no, thank you. Like, I'm not interested. And it kind of puts us in a situation where sometimes you're in shock and you're just like, oh my gosh, like they said no, like up front, like no, they sometimes hang up and you're like, oh, like I wish I could, you know, give it another try. So us at First Choice, we do like to, you know, do second attempts. So we try in a month or so, you know, try again and see if the patient maybe changed their mind, if they have other opinions. And yeah, some situations vary. Like I said, some are straight up no's, but a lot of the people, you know, they do appreciate our calls and they do say like, wow, I didn't know you guys had this at, you know, at the clinic. I didn't know you guys offered these services, especially with COVID. Like just yesterday, I did a tabling event at Los Lunas Clinic, and a lot of the patients were like so thankful that I was there, you know, just providing COVID kits, because they say, wow, like I didn't know anybody was giving these kits still. And it's just very rewarding, you know, to help our community and give these resources for them.
Is there any area specific that you want to move into as a CHW? So there's different, so now you're focused on COVID. Is there any, you know, maybe around cancer screening, or is there like a vision that you have? And this is just a very personal question. And I think health is very broad. And so I'm just curious, as a CHW, like where do you see yourself in the next, you know, 5 years? What would you like to address, or what have you seen, or how do you want to grow in that?
Yeah, definitely. I would really want to grow as a community healthcare worker, especially at First Choice. It's such a great agency to work in, and I know they have a lot of opportunities. But definitely, you know, providing a lot of teens with health education. I know sometimes we do talk to teens and they are not sure on what's even going on, like how they could make a preventative visit, what it even means. You know, a lot of their adolescent health. And I see that that's a huge barrier, especially here in the South Valley. A lot of teens, I feel, are like afraid of getting that help. And I hope to be that person, you know, that gives them all the resources that they could get to improve their life and their quality of well-being. So definitely, yeah, grow. I want to grow as much as possible, and of course help in every aspect, but I think right now that's like my passion, you know, helping teens and getting the quality care that they need.
So we're actually going to have a panel with teens talking about health. So I definitely want you to join us when we have our teens and our youth, you know, so we can actually kind of get their side. And I apologize, that's my bulldog.
Yeah, definitely. We'll be there.
Thank you. And Crystal.
I agree with Karina a lot with the whole helping out kids, because I feel like the youth and teenagers in general just have a hard time coming up to someone and trusting them with some of their health needs and some of their concerns, because they don't want to go to mom and dad. They don't want to have to sit there and say, hey mom, can you take me to the doctor because this is going on or something. So I want to be that person that they can trust to do this. I was in education before, and I was that person for the kids at the school, but I want to be that for the community as well, not just strictly at one place. I want to be able to help a bigger, I guess, circle of children and youth to get the help that they need, that they're scared to ask anybody else for.
And I really think that's a gap, you know, adolescent health. And I know at the Health Equity Council, part of our team is working on putting a youth, kind of youth council together. So that would be a really great opportunity to even merge and kind of look into that. But I do feel that that's a gap in a lot of different areas, and working with COVID and these different, we really haven't addressed or really got into that idea around health or educating adolescents. So that's a very important space that I just don't think we've tapped into. So that's just really, really great insight. And I'm sure it's great insight for you, Fred and John, like thinking through the adolescent, and you know that this is something really important. And maybe even Teresa thinking through how do we educate or provide things, you know, material for adolescent to kind of understand adolescent health, right? So a lot of these health behavior trends start very young, and so they kind of translate into the adult population that we're seeing. And so that must be a very critical point of intervention, kind of bringing all of your work together. My next question, I think, is around for Karina and Crystal. Just talk about, I mean, what have you seen? And you might have some areas that have been more difficult to work under, but during COVID, you know, and now moving out and kind of thinking through this long-term recovery piece, what are you seeing with the people that you're working with, and kind of change, you know, maybe something stood out to you amongst the people that you're working with, apart from adolescent, but you know, just in your real day-to-day experience.
So something that I do notice a lot when I'm working is I notice that the elder communities are the ones that are more, I guess, afraid of COVID, and are the ones that are trying to, you know, stay more safe, get all the vaccines that they can, you know, get all the testing kits that they can, get masks. We do create a dynamic list in our First Choice where we target patients who don't have insurance, who are part of the elder population. And usually when we call those patients, you know, some patients are like over 80 years old, and they answer and they take their time, you know, to tell us what they're feeling, their fears, and how they, and most importantly, ask how can they stay safe. And I think that's such a impactful, you know, situation to be in, and for us to be helping, it's great, because, you know, sometimes we see this population and we might not think much of them, but I mean, they're super important just like anybody else, and we want to make sure that, you know, no matter the age that they're in, we want to give them all the access that we can, all the help, and, you know, be there, and most importantly, listen to them, because sometimes they just need someone to talk to. And yes, some calls may be more than 15 minutes, some may take about an hour, but you know, I think that's very important part of being a community healthcare worker, that we're there, you know, to listen and to be there for the patient. So yeah.
And Crystal, how about you? What did you see?
So with the elder population as well, I could see where Karina's coming from, where she's saying that they like to talk a lot. I feel like a lot of them don't have anyone to help them out with any of the stuff that we call them about. And so they do just want someone to listen and someone to show that they care about them. And they're very interested in getting all the protection that they can. Anything is great for them. And with the younger kids too, there's some of them that if they answer, then they're all for it and they want to listen to you. But then there's some that the parents will answer and they don't want to talk to you. They say that the kids are like, no, they're not interested. They don't want to. But I do feel like a lot of the teenagers want to make that decision on their own, but they have their parents standing there and they're scared to talk to us, to want to get everything, that all the information that they do need or that they want. But I feel like that's a barrier as well, as parents getting in the way because they're scared of what could happen, that they don't want their kids to get it.
So it's this kind of tiered intergenerational differences in barriers and access and information. So that makes for a very interesting intervention point. We know that there was a lot of isolation. We know that suicide rates skyrocketed. We know that opiate overdoses skyrocketed. So we really are coming out of this, 2-year, this disconnect, right, with communities. So that work is just really important. I want to open the floor to Anna, Diana, any of our guests, just to share, ask questions.
Thank you, Carmela. Yeah, thank you. Thank you, Karina. Thank you, Crystal and Fred, John, Teresa. This has been really informative. I just wanted to ask, as health promotion, someone who attends tons of different coalitions and works in different areas, different health topic areas, how can maybe a health promotion specialist or another community professional, how can we support you? Is there anything specific we can do? Maybe provide information or connection? I just wanted to ask that.
I think, well, personally, I think just encouraging people, because who knows what clinics, folks may go to, but, there may be these type of services available, at clinics, and patients just aren't aware that our services even exist, right? And so, encouraging folks to ask the provider, if they're at their visit, is there anyone I can talk to? I'm behind on my gas bill, or you're just getting the public aware that this type of position exists. It's growing, the field's growing. Now we have, certification. You can become a certified community health worker. Hopefully as the field grows and as the position grows, it'll, I don't know if Fred for CASA, but at least our services at First Choice aren't truly billable, right? And so hopefully at some point in the future, CHW services will be billable through Medicaid. That would be huge, and then you might see clinics really pushing it, but just encouraging people to not be afraid to ask for help at clinics and wherever they may be being seen. That's my thoughts. Thank you.
I 100% agree with John. CHW, I mean, it's a broad statement, and the way we see it here, and the way I personally see it, is you're just a trusted person of your community, and when people trust you, you can make things happen, especially in underserved community. These people are disadvantaged. Sometimes it needs, I hate the word, a champion or whatever, but it could be anyone too. And that's kind of what I was getting to, is kind of we're promoting the CHW programs here, is because, your community neighbor can be your aunt or whatever. I mean, we all take this role at some point in our lives, where we provide information, we clarify on some things, and sometimes we need that dialogue. And it's amazing to see that this position is becoming more prominent within the community as far as healthcare is concerned, because sometimes people don't know what an A1C is or why it's so important to get these specific medications, and why. How can we explain that? How can we meet people on their terms? As far as like marketing, I'm not sure directly on or just specifically to the campaign or whatever, but what we've been working on is staying relevant to what's currently happening now. And by doing that is really just understanding where we are as communities. Why have people lost interest in wearing masks? Let's find out why. Why are people sick and tired of hearing the same message over and over and over again? How can we keep that fresh? How can we have a more positive, more empowering view on the subject? Changing that view on the situation. We're no longer the first year of COVID times where, everybody was on lockdown, everybody was in extreme emotional stress, everybody was in survival mode. Now it's time to be practical. It's time to start handling our self-care and the self-care of our community members. No longer being fearful, but also being smart about the situation is kind of like the direction. So by that, we're updating flyers, we're targeting specific community members, and we're making this information relevant to them, whether it be families with children, whether it be our queer community, whether it be our elderly community, whether it be just our Spanish-speaking community, whether it be the undocumented. These are all separate people that have separate, different issues going on that is important to them, and we want to keep it fresh for everyone.
Thank you. And, we have this, some people refer to it as the shadow pandemics, right? So COVID has really taken the front stage, but we have so many other disparities that were exacerbated during COVID, and that really changed the dialogue and the dynamic behind it. So addressing, cardiovascular disease, right? Breast cancer, it's our #1 killer among Latino women in the state of New Mexico. So cardiovascular disease is very, we have some of the highest populations of women. And if you break that down, by different groups, you're going to see that there's major disparities here. But those things have really taken a different seat, right? COVID really pushed, we're really very focused even on our data collection and trying to even remedy or understand those things. And so I'm thinking, how do we stay on the forefront of those pandemics, the opiate piece, right? We had a 200% increase in overdose deaths during 2020. So we have some of this new, they're just showing these major increases across the country. And specifically New Mexico, we've had a very hard, last 100 years with opiate death in the state. And so I'm just curious how, as community health workers or directors of your agency or in education, how do we keep those things on the forefront? How do we and this is more of just a question dialogue and maybe just thinking through collectively, how do we integrate what we're educating around COVID, but also those other things that are those underlying factors, right? We may see increases in some of those related to cardiovascular disease from the extra stresses that were imposed during all of this time. So we don't know the effects coming out, but I'm thinking, how do we stay relevant? How do we keep people aware of those different things that are happening? How do we do screening, or how do we embed, those in line with, what we're doing as far as COVID equity work? Because none of it, didn't disappear. It just, it's just not the forefront. Thank you.
Well, I that question was making me think, and I was going to ask Fred, because I know it sounds like you guys do like MAT services too for like opiate use disorder, and we have a MAT program at First Choice as well, and we were not getting any Spanish speaking. Like, we have a lot of Spanish speaking patients, but it was like it's only been for the most part English speaking patients who've been interested or been seeking out at least our MAP services, even though we promote it to all. So I don't know why that is, or I don't know if others have idea. And I know this isn't COVID specific, but just in terms of things being kind of pushed to the side. That's always been a question I've had. Like, I don't know why, like our clinic might be 50% monolingual Spanish, but our Suboxone program is 99.9% English speaking. And so, I don't know if it's just outreach needs to be improved to the Spanish speaking population in regards to MAT services, if it's a cultural thing, I don't know. So I don't know if others have had that experience or have ideas. Yeah.
I think, yeah, I mean, the majority of the people that actually go through our harm reduction programs mostly do speak English. But that's not to say that there isn't a huge group of people that still aren't, Spanish, but the majority are served that are mostly speaking in English. I think it is cultural, you don't really talk about that sort of stuff. Our approach has been, let's be a safe space to bring it up without any sort of stigma. Let's just bring it up. Let's talk about it. We're doing Hep C testing. Let's bring it up. A conversation. It doesn't have to be something that's embarrassing or hush hush. Let's be that space where we can just say, hey, this is what we have. Do you want to get tested for this? Do you need help with this? Do you need some fentanyl strip testers? Do you need all of these sort of things? We have them here for you. Word of mouth is a huge thing also, especially within our community. And I feel like the majority of the people that actually do come in is because of that transfer of information, that trust building that we've taken over the past several years. Again, we're also looking for new ways of being able to engage more with our communities. The way we have it here at Casa de Salud is we have our CHWs, at least 2 of them up front, that constantly connect with every single person that comes through that door. And whether it be just a 5-second chat or whatever, just to engage, to see where they're at. People are noticing that. People are realizing, hey, these are some new people that are in the clinic. It's okay, we can talk. And they're starting to be regulars. We're starting to noticing our faces and whatnot. And so there's that trust building that's coming through. Not only that, but calling, table events, getting out there. I mean, we've been doing this for 5 months now, and I think we've definitely made some huge strides in those initiatives. COVID isn't just our main focus. We have so many other programs that we would love to offer. We started offering the emergency rental assistance program. We're including that in our communications every time we communicate with clients that do come in, or anytime we get to communicate with anybody, just to get the word out. So,
and just to add a little bit to that, I think it's very important to ask our patients a lot of questions. Like sometimes if we don't open ourselves to them, they will hardly let us know, like, hey, like I'm struggling with this, I can't afford rent this month, or I don't have food. Like just today I was helping a patient with getting access to COVID tests and masks. And I asked her, like, do you need anything else? And she said, what else can you help me with? And I'm like, there's so many things that we can, as community healthcare workers, that we can help you with. Like, she said, I need food. My family's struggling. I'm like, definitely. Like, all you have to do is ask. Like, we're here to help you. And I think that's something so important to do for our community. Ask them a lot of questions, even though, sometimes they might feel the burnout. I think it's super important. And that's just an important way for them to open up to us and for us to give those resources, because there's a lot of resources out there. You just have to ask.
Thank you, Karina. Crystal, do you have anything you want to, maybe in your experience? And I'm going to give you the last word to share anything you want.
No, a lot of what everyone says is just pretty much like the same experiences that I've had. I do think we need to ask a lot of questions. I think we need to open it up more to being able to talk to like the younger kids. I don't want to say like kids, like teenager kids. I mean like the ones in their 20s their early 20s, I think we need to get more information out to them and be able to answer their questions, because a lot of them are really scared to talk and they're really nervous about asking for help because they don't want to put that out there that they need the help.
Thank you, Crystal. I have one. If somebody wants to become a community health worker, where do we send them? Where are their trainings? What can we provide to the public and those that are interested in participating in these types of programs? So any of you, that's open.
Well, I know CNM has a program to get certified, or it can lead to certification. I believe up in Santa Fe, they also offer the community college. I believe, I might be wrong on that, but I don't know, Teresa, Fred, or anybody else, if you guys know of other. You can also be grandfathered in, or you used to be able to be grandfathered in to become a certified community health worker based on the types of work you may have done in the past and hours. And there is a Office of Community Health Worker with the New Mexico Department of Health, and they're the ones that do the certification. So I don't have that link or that phone number on me right now, but if you just do a Google search for New Mexico DOH Office of Community Health Worker, there's some good information on there. So.
Yeah, there's a website that you could definitely check out through MCD Public Health, and they do offer where you can register, take the online class, chwtraining.mcdph.org. It's free. Again, you could definitely get grandfathered in if you've been working into the field for a certain amount of years. But honestly, the way I see it is anybody already has been and wants to make it official, go through the training process. But I think we've all been a community healthcare worker at some point in our lives through our relationships with others, whether you're giving advice or encouraging somebody or explaining or clarifying something. I mean, that's what it is. And anyone can do it, which is amazing because that's what we want. We want like just a plethora of people from different backgrounds and professions, everyone. That's what makes the initiative such a powerful one, is it empowers everyone. And that's what we need.
Thank you. So we have a policy recommendation that came out of this entire, and I hear that it's being able to bill Medicaid for the work of CHW. So that's a major policy recommendation that definitely needs to be taken to the New Mexico Department of Health and maybe working collectively with these different agencies to get that to be available, because what you're telling me is that this role is so critical, connecting trust, breaking down stigma, and really healing those and dismantling barriers, right, that are really holding people back from their potential. And so very important. I invite all of you to continue to join us about once a month when we go live and on air, and to have this dialogue, because putting all of our collective minds together, we can definitely come out with solutions moving forward. So I just want to thank you, all of you, for joining us this evening.